Hello and welcome to USA Homeless Crisis. My name is David, and today I have with me my friend Carl. And Carl want to tell us about what's been going on out here with the homeless people. He been having a hard time, and he have a story he would like us to listen to. How you doing today?
Today I'm doing better. I have a lot of medical problems, but I believe a lot of it is because I'm homeless. I was living in these apartments, went to the hospital for congestive heart failure. While I was in the hospital, the apartments evicted me because I wasn't paying them because my apartment wasn't going to pass the inspection for housing. So I've been homeless for about 3 months now, and yeah, I get a check. I get 2 checks every month, but I've been using majority of the money in a motel that costs $70 a night. Then the other times I'm sleeping on the sidewalk, and I'm working on trying to get an assisted living because of my medical issue. But right now, being homeless, I can't take my medication right because one of my medication makes me pee every 5 to 10 minutes. And you can't just be peeing on the street because I could get locked up for that. It's against the law to pee out in the public. Another thing is nutrition. Sometimes I go 2 and 3 days without eating. I've lost over 100 pounds. I used to be over 250 pounds. I weigh about 145 now. I'm a veteran.
Go ahead.
I'm a veteran, and I do have people helping me for getting me in assisted living because I don't supposed to live by myself because of my medical issue. But being out on the streets, sleeping on the sidewalk. The last few nights it's been very cold, and some of my stuff done got stolen, like my scooter. My telephone, tablet, portable oxygen machine, and it's a few other things that's been taken. And I can get it. I can get some more, but it's gonna take time, especially my scooter. I need my scooter because I have blockage throughout my body. So my legs cramp when I walk too far. It's a very bad cramping. I run out of breath because I have COPD, a small mild case of emphysema. It's hard out on the street, for us homeless people. I can go down to the shelter area, but that's the area that, I'm not accustomed to anymore because I have been there and I didn't like it because my mentality is kind of messed up because I've been having bad luck, so much bad luck, It's like if it weren't for bad luck, I wouldn't have no luck at all.
So Carl, let me ask you this. And you said you have COPD and some other health issues.
Yes, sir.
And you had your scooter stolen from out here. How are you making it right now without anything? This is a very sad story, Carl.
Believe it or not, there are some good people here in America. This one lady, I don't even know her. She saw me laying down on the corner here in Fort Worth. She woke me up, and I was in the direct sun somewhere I don't supposed to be. And the woman gave me $26. I went and got me something to eat, cigarettes. And yesterday, she came by, woke me up again, and I'm in that direct sun again. And she gave me $19. I only asked. She said, well, what do you need? I said, $2 so I can go see my VA casework because I'm a veteran. So she gave me $19. Of course, I went and got me something to eat, some cigarettes, and I kept a little change to catch the bus. So I did what I told her I was gonna do, but my caseworker, my social worker for the VA homeless program wasn't there today. They told me to come back. She told me to come back tomorrow because she talked to another staff member. So I'll do that, after I go get my medicine from the VA here in Fort Worth. I got medical problems. Like I said, got blockages throughout my body. I had 3 heart attacks, open heart surgery with a triple bypass. 3 cardiologists done told me that I was supposed to be dead, but God got more power than cardiology. So I'm still here, thanks to God's blessing and grace. And I'm trying to do my best to get out of this homeless situation that I'm in and get in assisted living so I can get my medication, let them distribute my medication to me, because that's what's, me not taking my medication is what's going to charge my life. So,
And you're a veteran too, Carl.
I'm a vet.
And we got to do more to help our veterans. Carl, let me ask you this, and I asked all of my homeless family on this channel to do this, because we have people out here who watch the channel that have very big hearts, and they help homeless people they see on this channel. And Carl, I want you to let people know how they could find you or get in contact with you if they would like to help you, because you need some help. I'm gonna help you today, but these other days when you may need some help, what area do you be in if people come looking for you?
Mostly on Berry and Riverside here in Fort Worth, Texas. I don't think there's another Fort Worth, but that's where I mostly be. Right there on the corner, it's a little, the building is empty, and I'm sleeping on the sidewalk, or sometimes on the, I guess you call it the entrance area, and that's mostly where I be. Sometimes I'll be in the Ace Motel on Riverside, and that's the area where I be mostly, because I used to live in this apartment called Sierra Vista, senior living. So the reason why I stay close to that, because I was check my mail, because I am on Medicare and Medicaid, and I'm a veteran. So I'm doing everything I can to get my health back in order. Maybe I'll live some more years.
Yes, sir. Okay, do you have any type of phone number or Instagram or any type of other contact? If not, they can contact you on my channel, Carl.
Okay, I'm going to try to get my phone and tablet back. I'm going to Metro, T-Mobile to get my phone, buy another phone, because the phone I have is broken. My tablet, no telling where it is, so I'm going to get a phone and tablet. My old number is 682-367-7469, and I'm hoping that I can keep that same number, because that's how to get in contact with.
Okay, and remember, everybody, you can get in touch with Carl on my channel, and I know how to find Carl and contact him and get in touch with him to where you can get with Carl and help him however y'all would like to. And I encourage everybody to help homeless people wherever you see them. And Carl, I want to ask you this one last thing while I have you here. Mm-hmm. Have you heard about what the president has proposed for homeless people? He proposed a solution to end homelessness, and one of the things is to help the homeless people who won't help themselves. For instance, if he deems a homeless person may have an addiction problem or a mental health problem, he can have that person put in a mental facility against their will to get help. Now, and the ones who don't want to get help, he said he gives them an option to, I guess, remain on the streets or do whatever. But what do you think about the option of being forced into treatment if you have maybe a mental condition or a drug addiction?
Well, as far as forcing someone against their will, I'm against that. But if a person, really won't help, that has a drug addiction, which I have a drug addiction, and I hate to admit, it's slowly dwindling down, because that's why I'm getting in a assisted living to get off drugs, take my medication right, go to cardio rehab and all this kind of stuff. But for forcing somebody to do something, and the president is wrong, you know. It should be up to that individual, and if that individual don't have the mentality to, you know, get help himself, or the addiction is so far gone that, you know, they don't care, you know, then there's courts. You know, there's courts that can give you a court order to get you some help. You know, I believe that would be a better way. You know, if they don't voluntarily do it, then, you know, maybe the courts can do something to help them.
Okay, well, I just wanted to let my homeless people know what they are proposing out there, and to get your input and what do you think about it, because I know a lot of the plans are radical, but I want to fight homelessness and end it, but I want to do it in a way that keeps my homeless family's dignity, where they can get on with their life. So yeah, I want to hear what my homeless people have to say, because homeless people are the ones that are living this nightmare, and they're the ones that best know what they need to get out of this nightmare. So I want everybody to remember to continue to fight to end homelessness, and whenever you see a homeless person, stop and talk to them, because they have something that they would like to say. And remember always to treat others the way you would like others to treat you.
Can I say this?
Yes,
one
sir,
thing?
you can, Carl.
Okay, there's, like here in Fort Worth, the Presbyterian Night Shelter has a program for homeless people where you go step by step to get out of homelessness into your apartment, house, or whatever. And you know, shelters do help our homeless people. They have helped me because I done been in the shelter, but I was in a program through the VA. And it helped me get an apartment through the housing, but it was called Hood VASH, you know, because I'm a veteran. The federal government was paying for my house, well, my apartment, excuse me. And so there is help out there, you know, there is help. It's just go to it. And I say that to all us homeless people. There is help. Use your resource.
Thank you so much, Carl. And like I said, is there anything else you would like to say? Because you're very well spoken, and you know what's going on out here with homeless people. So if you have any last words, you can say it now.
Well, no, I think I done said enough, because my mind is still
Yes, sir.
stated on getting this assisted living so I can increase my life.
Yes, sir.
You know, because 3 cardiologists told me I don't supposed to be here. God got that thing.
Yes, sir. Thank you so much, Carl. God bless you. And remember, everybody, let's continue to fight to end homelessness. And thank you for watching. And please hit that subscribe button, and let's continue to fight to end homelessness. Thank you very much.
Thank you.